I saw an insurance commercial saying that the era of 3 million dementia patients is coming soon. So if that time comes and you get insurance, does that mean you won't get dementia? Dementia is a very sad disease. You lose the people you live with, your family, and even yourself, and you end up dying in true loneliness. So we need to think about why it happens and why the number of cases is increasing so explosively. It's not just a matter of bad luck or thinking, my mother had dementia, so I'll get it too. There is a reason. For example, if you fall from the 20th floor, will you live or die? You'll die, right? What does that mean? It means there is a cause. There is always a definite cause. It's just that the causes are diverse. Just like there are many reasons someone might jump from the 20th floor, but if you fall, everyone dies. So, to put it simply, for example, if you have cerebral blood flow disorders, poor blood vessels in the brain, or problems with the nervous system, dementia can occur. Right? But the point is that there are just so many different causes. Then people say things like this. They say it happens because you're getting older. Whether you're old or young, there are many cases of early onset dementia too. If the cause is there, dementia will occur. But the question is, why has it increased so much? Why has that cause? What cause has increased so explosively? Would you like to think about it for a moment? So if your blood pressure rises, does that mean you'll get dementia? If your blood pressure goes up and you send more blood to the brain, then they say that's why dementia occurs. That's the logic. But actually, higher blood pressure has a preventive effect against dementia. So what do I always say? Yes, that's right. Your age plus 90. So for people who are 80 years old, if you add that up, it should be 170 for dementia to be prevented. Why? Because as heart function weakens, it can't send enough blood to the brain. That's why the pressure needs to be higher. But what are we actually doing to these people? We're giving them blood pressure medication. So what do these people end up experiencing? Orthostatic hypotension. For example, standing up and then suddenly collapsing. Why does that happen? Because blood isn't reaching the brain. Would you like to take a look at me? Are we only giving them blood pressure medication? When you give blood pressure medication, what kind of combination prescriptions do you get? Among blood pressure medications, things like ACE inhibitors put stress on the liver and can cause hyperlipidemia, right? This hyperlipidemia then eventually leads to diabetes. That's why people end up taking this set of medications together. The organ that these drugs fatally damage together is the liver. Have you ever heard of hepatic coma? When the liver deteriorates, it can cause a coma in the brain. Hepatic coma. If the liver is damaged and can't perform its detoxification function, and if it can't send blood to the brain properly, it's only natural that dementia would occur. Shall we take a look? Lower the blood pressure, prevent blood from reaching the brain, then reduce liver function. I always say this. Aging is being turned into a disease. If your blood pressure rises as you get older, it could actually help prevent dementia. But by lowering it, blood can't reach the brain, then the liver gets damaged. And if your gut function deteriorates, it causes problems in the brain. So if you look at dementia patients, you'll see this. Their gut is all messed up. They need enemas and all sorts of things. So what's causing this rise? Is it just aging populations? But then why is early onset dementia rising in the young? Why do people in their 30s and 40s get dementia? Why do people in their 60s get dementia, and why does this happen? Why are there people who are perfectly fine even at 90 or 100 years old? This means it's not caused by a simple reason. That is exactly why you truly need to become your own personal health expert. You see, maintaining good health is never simply a matter of random luck or chance. It is not just a case where people with bad luck suddenly get dementia. If you do not know the underlying cause, if you do not fully understand the body's warning signals, and if you do not have a clear way to address them, then you unfortunately have no other choice but to eventually fall victim to it. That's why I keep saying this. Become a health expert. Solving a few math problems isn't a big deal. Being able to speak a foreign language isn't a big deal either, is it? How many Americans do you actually meet, yet you work so hard on learning a foreign language? You need to fully comprehend and appreciate the senses in our bodies that we have to live with, and learn how to effectively find ways to substitute for their functions. You need to become a healing zone yourself, and provide essential care to save those people in need. That's why, as an expert, I tell many people, if you don't know everything from the cause to the alternative methods, and what medications to use in the future, and what problems they might have, if you don't know all of that, then you don't really know. Just knowing a little, thinking, oh, I know a bit. Do you think you know what it's like to be afraid of dementia just because my mother suffered from it? Do you really know why dementia happens or what it is? What do you actually know? Is that really knowing? So I just get scared. Is that what it means to know? If you really know, you won't be afraid. If you know, it's because it's dark and you're ignorant that you're afraid. If you know, that's why, as I mentioned during the lecture, a snake catcher isn't afraid of snakes. Why aren't they afraid? Because they know the snake's habits. It is absolutely essential for you to know this. You truly need to study hard and become a genuine expert in the field. Only then will you, your beloved family, and all those around you be able to stay healthy and safe. Yes, let us definitely keep on learning together. I will wrap things up right here for now.